to research stroke for this week. Okay. Do you guys see that? Okay.
Oh, there's flashing. I didn't know this.
Wait, this thing is like not. Okay, here we go. The main symptoms of stroke include trouble walking, speaking and understanding, as well as paralysis or numbness of the face, arm, or leg. So parts all over the body are affected when one might be having a stroke. The individual will have symptoms affecting their muscular movement, such as instability, stiffness, and hemiparesis, which is paralysis of one side of the body. They might also experience blurred vision, double vision, or sudden vision loss. Another common symptom includes abnormalities with speech, such as slurring of words or loss of speech altogether. Other symptoms that affect the whole body are fatigue, lightheadedness, and vertigo, which is like a spinning sensation or feeling dizzy. The individual may experience pain relating to that of pins and needles and a reduced sensation of touch. And then facially, their muscles become weak and numb. So for the assessment, there's history, physical, and psychosocial. So for history, the caregiver will determine if the patient is on any medications or if they're using any intravenous drugs. They'll also determine if the patient has experienced agnosia, which is the inability to recognize familiar objects or persons through a sensory stimuli, or if they're experiencing any memory loss, which is known as amnesia. They'll also gather a history of speech difficulties and determine if the patient has difficulty comprehending and writing words, which is known as dyslexia. They'll establish a history of visual difficulties such as double vision, which is known as diplopia. And they'll also gather a history of motor difficulties such as the inability to move the muscles, which is echinacea, and they'll ask the patient if they've experienced any numbness or headaches. For the physical exam, if the patient appears unconscious, determine his or her airway status and level of consciousness. The caregiver will also determine their level of orientation and their ability to respond to questions of intellectual functioning and speech, and also their hearing and vision ability. The caregiver should also lightly touch the patient's skin on various parts of the body just to, and ask the patient to identify like where they're being touched. And it's very important that they test the skin sensations on both hemispheres of the body as well. And then for psychosocial, it's important to be aware that many patients with stroke experience great despair and frustration because of the inability to communicate causes profound depression and agitation. So for diagnosis, stroke was formerly known as cerebrovascular accident. It's the interruption of normal blood flow in one or more of the blood vessels that supply the brain, as you can see in that picture. The tissue becomes ischemic, which means insufficient blood supply, leading to hypoxia or anoxia, which is the absence of oxygen, with destruction of necrosis, which is the death of cells, of the neurons, glia, and vasculature, which is the arrangement of blood vessels of an organ or part of the body. The causes, formerly known as Next slide. Cam's gonna go on here, it's not working. The main causes of stroke are thrombosis, embolism, and hemorrhage. And cerebral thrombosis, which is the most primary cause of stroke, a blood clot obstructs a cerebral vessel. It can also contribute to transient ischemic attack, which are known as TIAs, which are temporary episodes of poor cerebral perfusion caused by partial blockage of the arterial lumen. In an embolic stroke, a clot is carried into the cerebral circulation. Embolic stroke occurs when a blood clot travels from one part of the body and lodges in a narrower brain artery, blocking blood flow to the brain. And hemorrhagic strokes result from hypertension, rupture of an aneurysm, arteriovenous malformations, and a bleeding disorder. Alright, so for the risk factors, there are several risk factors that can potentially lead to an individual having a stroke. The lifestyle risk factors include living a sedentary lifestyle, so being overweight or obese, physical inactivity, heavy drinking, or use of illicit drugs such as cocaine and meth. And then the risk factors for medical, they include having hypertension, which most of you know is consistently high blood pressure. Cigarette smoking, having a high cholesterol, diabetes, and obstructive sleep apnea are all risk factors for stroke as well. And then for treatment. The treatment for a stroke needs to be initiated rapidly within 6 hours of the onset of symptoms in order to preserve as much brain tissue as possible. Medical management for patients with stroke typically includes support of vital functions and ongoing surveillance to identify early neurological changes as the patient's condition evolves. Recombinant tissue plasminogen activator is a protein that is used to help dissolve blood clots if given within 3 hours of the onset of the symptoms. In an hemorrhagic stroke, surgery may be required to evacuate a hematoma or to stop bleeding, and also a ventricular shunt may be placed in, to drain cerebrospinal fluid. As you can see in the picture, that's like the passageway for the shunt. And then physical therapy is begun as soon as the patient's condition stabilizes. Perform passive range of motion exercises on the affected side, and the physical therapist will teach the patient how to transfer with use of assistive devices and how to perform self-care activities. And then prognosis and follow-up. For prognosis, 5% of the population in North America over the age of 65 are affected by stroke. 10% recover completely, 25% with minor impairments, and 40% still require special care. And then the most rapid recovery for stroke occurs in the first 3 to 4 months, but some survivors continue to recover into the first or second year. So then for the follow-up, frequent range of motion activities are as taught in the rehabilitation unit, and also make sure that the family understands the importance of maintaining the mobility and self-care routine developed in the rehabilitation unit. And that's it.